I want to introduce our keynote speaker, Dr. Aletha Maybank. Some of you may know Dr. Maybank's work, and some of you may know her work, but not know Dr. Maybank. So you are in for a great treat in being able to listen to hearing her keynote speech. Now, we had to record this earlier because she was not in the country now today. So we recorded her talk, and then I had a little conversation with her at the end. So just to give you a little background on Aletha Maybank, she is an award-winning executive physician who has demonstrated excellence and leadership in public health, health equity, preventive medicine, narrative strategy, and her talk today is about building narrative power, health communications, and organizational change management to advance equity. As we mentioned earlier in the beginning of this, our foundational value is equitable access to healthcare for all. And so Dr. Maybank's work is pioneering in that space, and you'll hear an incredible keynote about many things that she's done throughout the beginnings of her career, including she's really been an honest broker and a convener of many different people who have been typically siloed. And she's also been she's launched several startup centers for health equity within health institutions, and most recently, she was at the American Medical Association and led a lot of the work that really reckoned with the AMA's past. So I am very pleased to hand over the screen to Dr. Aletha Maybank. Thank you.
Hi, everyone. Good to be with you. My name is Dr. Aletha Maybank. I am by training a pediatrician and preventive medicine doc. I have really spent a lot of my career in governmental public health, overseeing neighborhood health and many different topics, whether it's gun violence, maternal health, chronic disease prevention, but a lot of working with neighborhoods and communities on what does it really mean to be able to operate in a way that creates change, and operates in a way that supports building optimal health at the neighborhood level. And a lot of that has really helped me learn the importance and the power of narrative. I think at this time, many folks understand that the narratives that are told, the stories that are told, are important, whether for the good or for the bad. And so it's really an honor again to be here to speak with you about, what I've learned about building narrative power. And while I've been in public health most of my career, healthcare as well, launching centers for health equity within institutions, narrative has always been that kind of thread that I've always paid attention to and understood that we need to get those right in order to really advance health in the way that we want to in this country. So again, great to be with you. So first, a land acknowledgement. This actually comes from and is adapted from the American Medical Association's strategic plan to advance equity. Part of one of the plans, I was Chief Health Equity Officer at the American Medical Association, their first. I still find great value in a lot of the materials that myself and the team created, as well as many others across the organization. And so one of them is a land and labor acknowledgement. I'm sitting right now on the land of the Lenape here in Brooklyn, New York. And I just want to acknowledge that we're all living off the stolen ancestral lands of Indigenous peoples, which they have cared for since time immemorial. We acknowledge the extraction of brilliance, energy, and life for labored force upon people of African descent. We celebrate the resilience and strength that all Indigenous peoples and descendants of Africa have shown in this country and worldwide. And we carry our ancestors in us, and we continually are called to be better as we lead this work. And this is not to say that there aren't many that contributed to the context of this country and where we are today in this country. There are many folks from many different parts of the world who have. But it's really important to acknowledge, and when we speak about narrative, what are the narratives that have really been lost? And maybe they're still held amongst the people who have known them, but sometimes even the people who have lived them and known them at some point in time, they do become invisible and get lost over time. So it's critical in this context of equity and health and building narrative power that we unearth, we expose, we reinforce these stories that are very important to how the foundation of this nation was created and built. So at this point in time, it's how do we move forward together in action? I've been doing, again, this work for a long time in terms of bringing people together in order to produce, collective action. And, one of the contexts that has really come up lately, I think a lot of folks are figuring out, what do they do in order to act and respond at this moment? Many of you know and have been in the space of kind of advocating and organizing for a while, which is fantastic. But it's how do we get others to kind of join in and come along? And, the quote on the right-hand side from Angela Davis, you have to act as if it were possible to radically transform the world, and you have to do it all the time. I think this is ever critical. I think we hear definitely a lot of doubts and skepticism about where we're going as a country. Are we ever going to get to the vision that is potentially possible? And what's ever core and what a lot of our leaders have always said to us is that we have to continually believe, we have to continually hold the hope that this can happen and will happen. If we don't, you're going to have that outcome, right? Your intention leads to your outcome. And so we need to believe, we have to believe consistently as we move forward in action. And I'm going to provide over this course of 25 minutes or so, other ways that we consider, how do we look at narrative? How do we build on our strengths to ensure that? How do we practice, radical candor, operate in solidarity, always rest and provide rest, even in certain times that are hard, and continually possess a sense of courage. And so let's first start, at a foundational piece of what is public narrative? We operate it really in every day. It is, as this says, the fabric of our everyday lives. It's how we put meaning to what we experience, the systems that we experience, the happenings and the actions that we experience. And they play out into the laws that we have. They are in the arts, our mass media, as it says, our corporate discourse. And so these core narratives really are necessary to shape how we think about the world, our mental models, and our patterns and beliefs to make sense of the world. So public narrative exists. We all operate in it. And so it's just important to know that as a basic. What we also know is that there are certain narratives that are held in this country historically and worldwide that you can either call dominant narratives. Some people call them malignant narratives because oftentimes they can create harm. And they're embedded again in our institutions and our policies, as I mentioned before. But these narratives also tend to marginalize and silence certain voices of those who have been historically marginalized or historically underinvested in as communities and neighborhoods across this country. And they shape meaning, and which means they shape action as well. And because of how they're structured, it can really work to obscure the power of how is this happening? Who did this? Who's responsible? And it's really also works, as we know, to divide our communities and our populations to believe that that person has this more than we have this. And we have to really work to overcome this particular kind of strategy and tactic of power that is malignant, that can be bad. And so we're very clear that, especially financial power, when it comes to, structures around laws and policy, definitely drives narrative, and the narrative drives action, and also the culture of which people believe and how they believe and how it's structured as well, and the policies that are set forth in response to oftentimes those in power and the culture that they envision that they want to have. And that, again, can be dominant, malignant, and ultimately harmful. And so our roles have been, whether you're in community organizing or you're in your institutions, doing work around justice, you're a health professional, as patients and patient advocates. Your role has really been a lot about how do we, unearth and name these narratives that are potentially harmful? And then what are the narratives that we need to hold that actually support optimal health? When I was at the American Medical Association, we worked in partnership with AAMC, the Center for Health Justice. I know you've had Dr. Philip Alberti be one of your keynote speakers before, and he was one of the core partners, thankfully, on creating this guide here to language and narrative concepts around advancing health. We really felt that health professionals needed to have an understanding, again, about the power of narrative, the power of the language that's being used and the concepts that are formed around them. And as I said, there are these dominant and malignant narratives, and they really completely undermine our ability to really experience optimal health within this country. And why somewhat of what I mentioned before, when you have the narratives and they're not quite the accurate ones, they're going to shape our beliefs, which means they're going to shape our actions and our systems and the way that they're designed, which means potentially they're not going to be designed right. They're going to be misguided solutions that are created because they're built on oftentimes false notions and myths and beliefs that just aren't fully accurate. And I'm not going to go through each one of these below on this slide, but you can see them here. And I can give it, as an example. In health, the second bullet that's there, I worked a lot in public health, and there was at one point in time, a lot of the movement to make communities better, or to believe to make communities better. It was just about lifestyle choice, right? That's what was pushed forward as a physician, as public health practitioners. That's what you told people. You need to just eat healthier. You need to work out more. You need to do all these things without taking in consideration, did this community and this individual actually have access to these opportunities that we wanted them to pursue to make these lifestyle choices? Your lifestyle choices are very much in response to what is in your neighborhood. What do you have in terms of your resources, whether it's your financial resources or the resources that you have in your relationships with people? And how does politics influence kind of the structures and the laws of the policies and the history that is set up within the neighborhoods that you have? So if we are talking about improving health and we don't consider the political, the structure, and the social nature of what's there, we're really going to be misguided in how we offer solutions for our communities to be healthy. And we often, when we do that, we tend to blame the person and the individuals and the communities for having bad health when there are all these other factors that are contributing to bad health. So that's an example of how narrative really can shape the actions and the policies, and then also not align as well. So, in this moment, and I think as we talk about narrative, and you all, I know, as advocates, have stories around, how you built power, but I'm going to go through one of the, I think, most compelling moments that I've had in terms of doing this work. Again, bringing together the intersection of government and, neighborhood realities and organizing at the neighborhood level, and the history of what's happened to neighborhoods in terms of underinvested, not being listened to. And so this picture here is a group of advocates from, actually, there are politicians, there are authors and journalists, there are reproductive justice rights folks in this photo, many different photos, and community residents who have lived in the neighborhood. And this is Central Park in New York, on the east side of Central Park, where East Harlem is located. And for years, the residents within East Harlem, had been advocating, for a particular statue, and it's a statue of J. Marion Sims. J. Marion Sims is considered the father of gynecology, and his statue was here. You can see it, and I'm going to get to the story of where it is now, but was here for many years. And knowing the history of J. Marion Sims, who, and we know this history because he wrote his own autobiography, but he actually was considered a key innovator in many of the tools and instruments that are used for women's health and in gynecology, most specifically, even to this day. But in his process of creating these inventions, he also experimented on women who were enslaved without anesthesia, even when anesthesia was available at a certain point in time. And so, as this illustrates the amount of harm that was done, what was interesting, and I don't think interesting, but also harmful and painful, is that those narratives of those women and that particular part of the story was not elevated that often within the context of medicine. J. Marion Sims actually ultimately became president of the AMA after he did all of that in a hospital down in Montgomery. And then he ended up coming to New York, why the statue is there, and opened a women's hospital at some point in time. The woman who is in this photo, who has kind of a black hat and to the right of the picture, she has on a coat that has black and white in it, like a wool coat that's long with kind of white fur around her wrists. Her name is Harriet Washington, and she wrote the book Medical Apartheid that many may be familiar with. It came out quite a few years ago now, but this was really the moment in her book where she elevated that narrative, that story that had been really hidden for so long about the role of J. Marion Sims in the movement of health during that particular time. And many of us heard about her work, especially in the health profession, and learned about the work of Sims from her book. And this is where it becomes the importance of writers and journalists, to be a part of this movement to build narrative power. And the way she told the story absolutely moved and motivated folks. People came together. It built power. So it's not just the residents who had a sense of the history, but now it's all these other sectors who also knew the history, who started to come together and advocate and really put forward compelling narratives that were, essential for transforming power. And so around 2017 or so, the Mayor Bill de Blasio, at that time, actually pulled together a commission to look at all the statues across the city to make recommendations on which one should be removed. And this was the one that was recommended to be removed. And again, we speak to the context of narrative power and what that means and what it can actually do. And so in April 2018, after this was the statue that was determined to be removed, I was out there I was deputy commissioner of the New York City Department of Health that time. The arts commissioner was out there, and you can see Harriet Washington in the middle. I'm on the left, and then on the right is Dr. Lynn Roberts, who's one of the aunties of the reproductive justice movement and of Sister Song. And so we were all there when that statue came down. The photo on the far right side with me hugging someone was actually a woman who was running by. I honestly, that gets me every single time I tell the story because I can feel the emotion of that moment. But she was running by and she said, "I never thought anybody would take this statue down that had this narrative, held this narrative that made us invisible and made our community invisible, as if we didn't exist, as if our pain did not exist." And so she asked, and she just turned to anybody. I didn't know who she was, and asked, "Can somebody just give me a hug?" And so that's exactly what happened. And so when we achieve narrative power, there's a presence in a way that forces changes in decision making, and then the status quo and real material value added terms. That's how when we know we're successful. And there are many moments in history when utilizing narrative power that we have been successful in change. And so it's not only about how do we take down and dismantle, but it's also how do we imagine and claim. So an artist, a couple years later during COVID in 2021, now we're going down to Montgomery, where I mentioned before, where Marion Sims did a lot of the procedures within a hospital that was down there. And there's artist, Michelle Browder, again, an activist and artist. So again, the importance of arts to help us kind of really see as well as shape, advocate, and build that power that we need in narrative. And so she built an amazing piece of art and piece of work that's in Montgomery right now still, called the Mothers of Gynecology. And you can go down and visit, but it's quite remarkable, in honor of Betsy, Lucy, and Arca, who were three of the women that were listed and mentioned and talked about the most in his autobiography and other documents as well. Michelle also, not only did she build this monument, but she said, you know what, I want to claim the space as well that he did his surgeries out of. And she did. She bought the building and she's turning it into a museum and working to make sure that it is a place for education. She has also been advocating strongly. There's still a J. Marion Sims statue that sits at the Montgomery Capitol, and working and advocating and building power with many across the nation in order to have that statue removed as well. So that's just one example. Again, I know there are many examples, but that's one example. The other part, as we talk about narrative change, and I think this is also at the intersection of organizing, is how do we ensure that we are talking about the people who we're talking about, who are talking with in medicine, are also providing like more of a strength-based, asset-based approach, not just a deficit-based approach. You know, I say all the time, and we used to do this, you know, as an example, Black women are 3 times, you know, wherever in certain places, 3 times more likely to die of childbirth as a result of it than white women. And New York City was even higher, 10 to 12 times higher. And I said to myself, now it's an important number to know. We need to know where the gaps are. We need to know the differences. But when I'm talking and speaking with my community, I'm a Black woman, identify as such. I'm a woman, as I said. I want to build from the context of strengths. That's how we all build. And so oftentimes just presenting the deficit model doesn't always help us. I think sometimes it's really helpful to know, well, where are people doing the best? Where are people living longest? And what's happening there in those spaces? How are we building this strength-based approach? And this is the Black Progress Index done by Andre Perry, who's over at Brookings Institute, did this in partnership with the NAACP, looking at cities across the country where Blacks were predicted to live the longest, and then looked what was happening in those cities of what potentially could be the reason for why they were living longer. And interestingly enough, if they were foreign born and all the concepts around, you know, maintaining culture, income, which it can be really important in this country of your original home country, income, home ownership, all those things that build wealth and build assets and what you have access to, higher education rates, things that actually, for the most part, make sense, but it's really helpful to have it in this presentation as well, because sometimes institutions don't want to pay attention to that, or leaders of institutions, and we need to have that information. So again, a strength-based model. Then how are we in solidarity? I think this is an important context of narrative power and a really hard context. And I think the more that we're in this social media environment, not that social media is bad, there are elements that are absolutely harmful that we are aware of. And I think there's more that we need to learn and more that we need to restrict for ourselves in terms of the time on it. I think for our children, the time that they spend on it, because I think it is impacted is how we have relationships with one another and how well we can actually just be with one another, and especially for young people. Solidarity means oftentimes you need to have trust. You need to have proximity. You need to be able to talk to people. And you need to be able to willing to let go of some of the pieces that you hold on. Solidarity does not mean that everything we want happens. It means how do we come together to build that common ground and figure out how are we going to move forward collectively. It is not easy, but definitely possible, and something we need to get to as we think about narrative power. And in the context of the power part, and power, when I say, you know, it's more so the context of numbers, right? People, we need more people, we need more voices, we need more stories that are saying similar narratives. But oftentimes this work definitely has to start with ourselves. I used to hear this a lot about the revolution will not be televised, which was, you know, pulled from Gil Scott-Heron's song, an art piece of art, again, poetry, that he did and presented in 1971. But the reality is like it does start with ourselves. And when we start with ourselves, then we are able to come together, you know, as a group. I also feel for you all who are patient advocates, one of the things that I hear over and over is that, you know, health professionals aren't supposed to be political, but be really clear. Health professionals have always been political. The nature of organized medicine is political. They are advocating to politicians. And so it is political, and health professionals need to be with patients, advocating and being at the front line at this day and doing this work. And there are many health professionals that are on the front line, but I just wanted to kind of speak to that narrative around that health is not political, that health professionals, shouldn't be involved. And so when you have those conversations with those health professionals, some of you may be health professionals, know that it is your place and your full right to be engaged with ensuring, again, the civil and human rights of our folks, and that we all have optimal and the experience of optimal health. We need to continue collecting stories, again, across many different types of vehicles in medium. Social media is one of them. I launched a film company, so that's why I'm here as I've resigned, because I really value this context of being able to expand this narrative around what creates good health and what creates bad health. But whatever that vehicle is that you're going to use to collect the story, we need to collect more of them over time and to preserve those stories. Another piece I think is really important as we work toward this context of being able to be in relationship with each other, operating in solidarity, building narrative power, is the ability to speak with each other with great direct compassion at the same time. I still hear a lot that I'm a very candid person, and I was reflecting on that. And sometimes it actually becomes exhausting to be the only person in the room who kind of speaks up with a level of compassion, but is always speaking up. We need more people to do that and to know that you can do that. And it's a good thing to do, and we can all do it compassionately as well. And then rest and joy, another aspect. These are needed to survive. When we look at the history of many of our historically marginalized folks within this country who came to this country from many different places across the world, joy was a critical piece of survival, whether it was through music, whether through dance, through writing, through the arts. We have the right to experience joy in that context, even in the context of hardship and hard times. And we need to find that. That is a form of rest for us. And so I highly recommend, we find the ways. This is Rest is Resistance by Tricia Hersey, one of the tools that are out there on kind of challenging ourselves and the narratives we have around work and rest and the structures, that we live in and what's possible. And then lastly, I'll elevate, and this has always been, again, this speaks to the point of radical candor, especially, but I think also even being proximate and close to one another, this concept of courage. It's the most important of all the virtues, because without courage, you can't practice any other virtue consistently. And I think in this moment of time, many of you have already exhibited great levels of courage, and we need it. And we need others to show up with great levels of courage. That doesn't mean, some people will say, well, that means I don't have any fear. I would never say that for myself. In the context of courage, in the context of speaking up, and sometimes in doing things and positioning myself in certain places, it's not that I don't have fears. I do. I think that is a human condition, and they both can exist. But the goal is, and the work that I do around that when I have fears, is just the ability to be able to talk about it. I think the context that, for me, I feel I have an obligation. I'm standing on the shoulders of many, both present as well as ancestors who have led this work. I'm here being able to do what I do because of what others have done, and I have an obligation to continue doing so. And I know many others felt very fearful in much harder times than even we're experiencing now, even though now is a time where we have to really organize. And then lastly, as I mentioned, I moved on from my position. It was time for many different reasons, but I have put forward that for me, I'm going to continue to lead in the candor, figure out what it means in holding accountability for equity, justice, freedom, liberation, and joy for me at this moment in time. But the quote that always stands out in my mind, and if many have read any of Nikki Giovanni's poetry, who has passed away last year, She said, if the enslaved could believe, then so can I. And so that's, my final note is, again, this context that we have to believe, we have to have hope, even though it's hard, but that is part of our intention. And it's a big part of our intention to get to the point and to sustain and maintain the freedoms that we have and we wish we have. Thank you.
Thank you, Dr. Aletha Maybank. That was just amazing. I have to say my breath is sort of catching on as I think about what you said, and as I think about some of the themes, and I think what I and maybe many others have such a reaction to right now is kind of the erasure of the truth. And how do we act in solidarity and encourage to make sure that that truth is not erased? And I love the quote that you pulled out from Ida B. Wells: the way to right wrongs is to turn the light of truth upon them, as you were talking about the film company. But I think it's also not simply turning the light of truth, but actually standing in that light as well. And I'm wondering if you can talk a little bit about that, and that kind of notion of not simply shining a light, but also standing in the light. And what does it mean to work in solidarity? And what does it mean? What are some of the things that we can do together to ensure that that the truth is not erased, and that some of the and the progress that we've made in terms of health equity and health justice, and so many people on this in this summit have spent a good part of their lives committed to.
Yes. So thanks for the question. And thanks for starting with Ida B. Wells. I think it's, if folks know her life, she definitely did her work. So she wrote one of her main moments of what she's known for is her journalism around the Red Record, and creating a document and documenting, right? So to your point, so lives would not be erased and forgotten that were lynched and being lynched during the Jim Crow era. She made sure, not only just for the point of advocacy to say that this is happening, look, this is an injustice, but she also did it to say these folks existed and we cannot forget about them. And I'm not going to let them be forgotten. And she did that at great harm. So to me, she didn't just shed the light on it. She actually stood in it, right? She went to these places that are unsafe. And that's what I think about, when I did the narrative guide, and when that was released in partnership with AANC, that was where I realized that narrative power is really strong. Anybody who challenges narrative exposes truths that may have been, people have been working to erase or oppress. That's when you're going to get the greatest reaction from power structures that want to oppress them. And that was the time of when I did get death threats, right? I did get somebody coming to my door and painting something on my door, died in the B word, and I had to have security detail. And so it was Ida B. Wells that I thought about, truthfully. She never had security detail to take her across all the different places that she went in order. I'm sure she had community who knew she was there and it would help out at various times, but she didn't have security detail to walk her through all those. She stood in it, as I'm sure many others did, to help her collect all that data. We don't ever do anything in isolation. So that's what standing in it is with others. It might not be to that level of extreme, but how do we show up for people outside of our own self-interest, I think, is one piece of it. I think another piece, because, oftentimes we hear, well, that's not my experience. This is my experience. And the reality is, in the nation that we're at, and it's always been this way. And we've always heard these kind of quotes. The justice that you experience is going to be the same injustice that I experience. Right. And so it in some way, shape, or form. So it definitely works to our benefit to build that power, to be proximate with one another, whether in the literal or in spirit, or in conversation, so that we can have greater power as a community and a unit. And we can have this opportunity to work to drive, I would say, down the oppression or away the oppression, push it away, and then build and reclaim new spaces for ourselves. That's how it's always been historically done. And I would say in this moment of, I think it's obvious erasure. I think a lot of folks are being exposed to things that have already been existing for a very long time, right? And it could be on one end, I hate to say it in this way because sometimes it can be misinterpreted, a good and an important, maybe I'll say an important moment for this country. Because for far too long, only certain groups were fighting for justice, fighting for rights and freedoms. But now more people are experiencing the loss of freedoms and just the ability to just even have food on your table when at least you were able to do that, you know? And so I think that those are the moments of solidarity that we need to start seeing so that we can build for better.
And I think you talked about it really briefly before. I mean, you talked about it in your remarks and on one of your slides. But this whole notion of American exceptionalism also is related to our notion of individual exceptionalism, which is what you just mentioned, which is that, no, this could never happen to me. This is not about myself. This is not about my family. And I think right now, as you pointed out, we're seeing that it really is about all of us. And this morning I was reading a story about a woman who was an Air Force fighter, Air Force pilot who's, when you go on click on her link on I forgot the Department of Defense site, you get to the error 404. So we're seeing error 404, page not found everywhere.
Everywhere. And I think, again, for folks who haven't, there's a kind of a metaphorical piece to that, but for folks who haven't experienced that, it's jarring. What do you mean page not found? What do you mean I'm not found? What do you mean my work is not found? What do you mean I don't exist? My efforts don't exist. But that has happened for people for ages. And I think, again, moments like this, I'm hoping, and we're starting to see some of it, push us into that greater space of solidarity so that we understand better where's the enemy, where's the problem, and how do we organize around that? Because there's nothing that feels good about being erased and the work and efforts that we have to be erased. I also feel this moment in time is providing a certain level of education about our systems and the structures that exist in this country that many people were not holding because our educational system, for very intentional reasons, we're not raising and creating a population that has a strong critical consciousness about the systems and structures that we live in, because there's a loss of historical context, right? In erasure of history, it's an obvious moment now of erasing history, but it was always there and always present. And I think it's, again, us seeing what we didn't know before and knowing that we don't know everything, I think is a really important acceptance. And operating again, and how are we going to show up with one another to be an accomplice with one another, because it is really depends, or our collective freedom depends on that. Which then our individual freedom depends on our collective freedom. And a lot of folks, I think, are starting to understand that better.
I think they are, and I was actually going to ask you what sort of to close out with what gives you hope, but you really just answered that, and I think that one of the other words, one of the things that I've been on a quest to do for years is to reclaim meaning of a lot of words that are really, really important, and one of the words that you use throughout your presentation is courage. So, and I think it is a much more multifaceted, nuanced concept and action.
That's right.
And verb. And if you could just close us out by talking a little bit about courage and what that means to you as a call to action.
Yes, I think courage at its root means, I'm going to say it, doing the right thing, like speaking up, doing an action of something that is the helpful piece of action to do the helpful words to do, even when it can be scary, tricky, or dangerous, right? People do it all the time for their children, actually, right? People show up courageously for their children all the time because you have such deep love and desire to protect. And so if we held that deep love and desire to protect us all, we would be, I feel, a lot more courageous to stand up with and for each other in that sense. Yeah.
That's thank you so much. Your talk has been so not just inspiring, but also really energizing, because I think that's what we really need at this moment. We need to be energized. We can't just, we need to have some sense of different paths that we can take and how we can work in solidarity. And thank you so much.
Oh, you're very welcome. Thank you. It was an honor.